My name is Matthew Borkovich, and I'm an interventional cardiologist here at Intermountain Health, Logan Regional Hospital. So I always knew it was cardiology. Yeah, that was sort of a natural thing. I always enjoyed everything about the heart, cardiac anatomy, cardiac physiology, pathophysiology, including pharmacology of cardiac disease. I started very, very early, about the age of 6 years old. I used to draw the heart on the back of sort of at restaurants on that piece of paper, and used to draw the cardiac structures. So I knew all the cardiac anatomy as a kid. To see somebody come to the hospital who's critically ill, having a heart attack, and they're able to have a cardiac intervention and then leave the hospital and walk out of there doing pretty well is a very satisfying thing. The first time I see a patient in clinic, I want to know everything about them. I want to know what their past history is. I want to know what they do for work. I want to know what their hobbies are, because I want to see, how best I can help them and individualize the therapy for them specifically, not just overall. In general, the philosophy of care is doing what's best for the patient, talking to the patient and having an individualized discussion with them, because perhaps medication is right, perhaps an intervention is right, and I think it's a very important discussion to have with the patient. Oftentimes, patients are in the hospital or they go to a clinic and they leave the office and they don't really know what's going on. And some of this is because there's a lot of things happening, complex disease, but I think to try to sit down and get them to understand their disease process, it really helps them be more involved in their care. It's very important to have a good patient-physician relationship. It's all about the bond. And if they trust you, they're going to be more willing to come and see you for follow-up, express concerns if things are changing. So it's a very important therapeutic bond between a physician and a patient. Patients should be at the center of their own health. It's important for them to gather all the information, make a decision, be motivated, and this will help them get to their goals. I think a very important message for patients who have disease is that things can change with lifestyle modification, medication, ongoing therapy, but these changes take time, and that actually it's important to be patient. Things don't usually change from one day to the next, but over the course of months or years. So to hang in there and stick with it.